Positive? Both? Hello again, everybody. Thursday, April 16th. Welcome back. We're going to go straight into our daily updates. So let's get numbers for the United States. Yesterday, 619,000. Now we're at 653,751. Continues to go up 30, 40,000 a day. Deaths. Is this right? Was this our deaths yesterday? 27? So they must have, I don't know.
Did they add that New York 4,000?
Maybe they added the other, maybe something, because it's a significant increase. I'm not sure what happened this day. We were listed as 27,000 yesterday. Now 33,434. So I think they must have updated some numbers from, maybe those New York cases that were assigned as COVID deaths. So well over 30,000 deaths now as a result of COVID. So this is far past the average flu season for deaths due to the flu. And wait, hang on. We just got an update from our testing site. Awesome news came through right here while we're doing our update. So again, that's for our testing site, remote testing site that we're trying to nail that location down. So a lot of deaths. We don't know the exact number overnight because I think they added some additional deaths in there. So we'll continue to track it though, as we have been. Cases for Marion County, they have yet to release the midday update. So we're going to use last night's numbers. 104 cases, now 106 cases. Again, still just with the 3 confirmed deaths. Hospitalized at this point, 9 yesterday. They're listing it as 8 now. And then I have a new line here for recovered. A few viewers have asked that we track those recovered as well. This is actually a conversation that we had with the health department when we visited them. What day did we visit the health department? Earlier this week, Monday, Tuesday, something like that, earlier this week. And we asked them this specific question. Because this illness lasts so long, in fact, our PUI 21, who first became sick on March 17th, was her first symptom. We saw her a little bit earlier today. She came over to do a test for us very kindly, and she is still not symptom-free, and it has been a full month. So at this point, we have no recovered people. This is a very long-lasting illness. Even the people that have been maybe hospitalized and they've been discharged from the hospital, they are not yet fully recovered. Very, very long illness. 1 month, easy for many, many people. The way that we will identify people that have fully recovered from this is only when they have been symptom-free for 2 weeks, and then we have to re-swab them again to be sure there's no more virus inside them. In our county, we haven't even started the re-swabbing process on people to figure out if they've completely cleared the virus. We're just too early for that. So right now, this will be 0 recovered. This will stay 0 recovered for quite some time, actually. How about we do this? Let's keep the cases low and let's get the number of tests up so we can find as many people as possible. Over to testing sites, again, remains unchanged. I mentioned this yesterday. I'll mention it again. Anybody that has a doctor and you're feeling unwell, your doctor can write you an order to get the COVID test done. The health department has that drive-up test site, and if you have that doctor's order, you can get your swab done right there at the health department for free. Quick and easy. They can get you in and out fast. They all remain, and just like you saw, we're hopefully going to be getting our higher volume drive-up test site up and running, particularly to attend to healthcare workers. We're getting a significant number of calls and needs. We swabbed again today. There was a doctor, actually a doctor who works in Orlando, but lives in Ocala, and we did a swab on that doc. A couple of other healthcare workers, some nurses. So we're really attending to the needs of the healthcare workers. We feel that there should be no obstacle for healthcare workers to get testing if they need it. So the list remains unchanged. We are working on our site very, very actively. Straight to our flatten the curve graph. So we've already written in the hospital information, admission data for overnight. That's from the Agency for Healthcare Administration in the state of Florida. Monday, Tuesday, Wednesday, Thursday, today. So the fluctuations we see, we're actually down to 455 people admitted. So that's actually the lowest number we've had so far. I am glad to see that. So let me draw this number in at 455. This will be our smallest line yet. Yeah, about right there. Okay, so I feel like Bob Ross over here. Let me just draw some happy trees. Anyway, we want this to continue to stay relatively flat. Remember, we don't want this to spike up. Like we've said many times, currently we are not. Still just 8 hospitalizations out of the 106 people that are sick from our county. So this is good news. Hospitals are well equipped. We've got about 600 available beds should we need it. So let's not get there. We do not want to become another hot spot. I just want to stress to everybody, this is important. If we were living in New York City right now, we would all be scared to death that we would catch this thing and we may die from this thing. As opposed to more spread out areas of the country, like Marion County is awfully spread out. So we won't necessarily generate the kind of congregation of people and the spread that they might get in places like Detroit, New York, and Chicago, and LA, and a number, New Orleans, I think, is a big hot spot. But that does not mean that we can't get a significant number of infections because we have a lot of facilities, we have a significant elderly population as well. And these are the places that can be big time hot spots. We also have some very large employers like FedEx, Chewy, for example, and they're still operating. From what I understand, even in most of those places, the employees aren't even wearing masks and gloves. So the risk for something happening in some of those businesses is possibly quite high. So we're going to have to keep very close watch of facilities and businesses that are operating with large groups of people, and there are a number that are still going. So we need to keep close eye on them. Okay, so again, this is good news that our capacity remains, and we want our curve to remain steady all the way through the end of the pandemic. That means we did a great job with mitigation, and that's what we want. We want to be the best county in the country, like I've said 1,000 times in the last 2 months. A little bit later in the video, you'll see we did a demonstration. There's the question mark of the antibody test kits and whether they're any good, whether they actually work or not. The availability of ordering FDA, not approved, but emergency use authorization, which is just an application that a laboratory might supply to the FDA. The FDA would review it. Pretty much if they like what they see, they're happy with the initial testing that the company is providing, then they'll grant the emergency use authorization. As of this morning, there are only 3 companies in the country that have emergency use authorization for the antibody test kit, and the availability from any 3 of those companies is 0. It would be a minimum of 2-3 weeks before we would possibly be able to get our hands on that, which means we have to use antibody test kits from other companies that have yet to receive emergency use authorization. So how do we know if those kits are any good? Well, we did a test here today. In fact, I have the kit. I've fully sterilized this bag on the outside now, so we're okay. You don't necessarily have to, well, I don't know, if you want to zoom in on this right now and we can see what it looks like. Are the lines good and clear?
It looks like it's like Sharpie line, like it's very
Yeah,
clear.
and so those are very clear. And so these are 2 of the same antibody kits. We did these finger stick tests on our own PUI number 21. Remember, that was the lady who we found our first positive on an antibody test. Not that company, but another one manufactured in the United States, which we have run out of those now. And it's a good indicator, initial indicator, that the test kits that we have actually work. We're going to try to track down more positive coronavirus patients so we can test the test kits. We're going to run a little bit of a research experiment right here in this clinic in real time, informally, but we don't have time to wait the 60, 90, 120 days for a more rigorous study on the test kits, and so we're going to kind of do it here ourselves and confirm that the kits we're using are reasonable as a tool to use along with the nasal swab. Again, we want to be doing both. I'm going to go ahead and close for a day. A little bit of a waiting game right now. We're waiting on the antibody kits. We're waiting on the test site location to be completely nailed down. And we have some work we got to go do this afternoon to completely work out all the details on what's going to happen at the remote test site. So let's go ahead and roll a short video for what happened here on this Thursday. Thank you, everybody. Good morning. Hey, can I have a piece of paper?
Finger stick, I do have a copy of your insurance.
What? That's like the dancing baby over there. I love your spring look. I love the layered look. That's some layers there. Yeah. Again, another reason why we need a covered area. Is that what those things are?
Yeah, so when you get a perm so your hair doesn't get wet.
Ooh, this person's coming in hot.
Coming in hot.
So on a timeline, we want to test as many people as we can, obviously, but until we get the drive-up site and we get more antibody tests in, we're in a slight holding pattern. If someone has been sick less than 7 days from the start of symptoms, then we do no test of any kind. No finger stick test, no swab, no nothing. We want the virus to brew in them a little bit with symptoms, at least a week, so the swab will be more accurate, more effective. So after 7 days, up to 30 days, they get both, no matter.
Before that, no test.
So start of symptoms, the first week, no test of any type. 1 week to 30 days from the start of symptoms, both. And then at the end of symptoms, longer than 30 days after that, just finger stick. Does that make sense?
Yep.
I've been sick or I've got something I want to get a test done. Okay. When was your first symptom? What day? April 5th. Okay. You can get a swab and a finger stick. I only want a finger stick. You can't get only a finger stick. You have to get a swab and a finger stick.
Okay.
You have to.
Okay.
Doctor's orders. You have to. Longer than 30 days, symptom free. I was sick in January. We know all that. That's obviously just finger
Right.
stick only. Does that make sense?
Yes.
Okay on that timeline? Try that with the calls this morning when you get them and let me know in a little while how that goes.
Okay.
Okay? It's ramping up. You feel it?
Yeah.
Remember I told you the next 4 weeks are going to be harder than the first 4?
Yes.
I wasn't BSing, was I?
No. Not at all.
Just wait. It'll continue to ramp up from here. We still don't have the test site secured. We're hoping to get that. We were hoping yesterday afternoon. It's in the works. We're waiting to get word this morning on our remote drive-up high-volume test site. And they are so busy on the phone. Look at this. They're just so busy on the phones. It's just non-stop calls, non-stop. So more people needing help, more people needing testing, and we need to accommodate that. Let's go have a check-in with Ange about the antibody test. We got a truck full of people that we're going to be testing. There's 3 people in this one vehicle that we're going to be testing. Mom, dad, and son. They're all symptomatic. So this is the truck of 3 people. What did you say? 102 and 103 fevers. Respiratory symptoms?
Yep. Their doctor was the one who called and said, I need them to be swabbed. I need them.
Okay. Well, I'm excited to finger stick them.
We're going to do both.
How long have they been symptomatic?
A couple of days. Let me clarify.
Yeah, if it's a couple of days, no finger stick. But
They sound
more
like
than a week,
Closing in on a week or 10 days.
definitely let's finger stick them. So we'll test again.
Okay.
I wonder if they've been to Wuhan,
Doubt it.
like Bahamas.
Puerto Rico?
You've been to Puerto Rico?
Yeah, they run by our
Did you swim there?
rules.
I did.
Just like exercise one morning. I'm gonna go for a swim.
Swam to Puerto Rico.
Whoa.
Oh, wait.
I almost,
Punched her in the face.
did you see what I was, and it was coming around right to the chin. Hey, Shirls. I got some feedback from your closeout yesterday in Espanol, and they said that you weren't speaking Spanish.
Who's they? So I can talk to them.
I don't know, but they're from Ecuador.
Good one.
Could we add someone on who's not feeling up to par?
Not feeling up to par?
Yes.
Not feeling up to par.
Yes, as of yesterday, I added her on the watch
We will
list.
give you a call, okay?
She's got like 99 fever.
How long has she been feeling not up to par?
Since like since Monday, I guess.
Okay.
I'm not feeling up to par. She's
Yep.
99. She doesn't have any chest
Yeah, if you haven't
issues. She
been
said
sick or
she's
showing
just
any
99.
symptoms,
She's
then you
tired.
don't
So
you don't.
her symptoms need to brew for 7 days minimum before we do anything. So there's still nothing to do yet at this point. The tests won't work yet on her. So, I mean, but we can get to her, maybe next week when her symptoms brew. PUI 21, can she help us?
Yes, she's on. She said she's gonna get ready and be on her way.
Like just kind of straight away?
Yeah, and she said she's seen the video, so she was gonna call us anyway. She's like, I was wondering about that.
Oh,
Like, it's
she's
like-
thinking of us. Awesome.
Yeah,
Okay.
so-
So we're going to get our PUI 21 who's confirmed positive, and she's going to let us test her again, and we'll see if our current finger stick antibody kits are any good. Yeah, you roll your window down. Hey, Doc. Me too. I heard kind of your story. We'll do a swab on you, of course. The kits that I have for the antibody, those are questionable, but let's do it anyway.
I know that it's not 100%.
But hey, let's give it a try and see.
I know, doctor.
All right.
Leah was the one that sent me here.
Yeah,
We love you. That's me. Tell me.
thank you. The moment we know, and we're looking every day, the moment we know, we'll call you and let you know. I would hope, Monday for sure. That's what I'd be hoping for. Our PUI number 21 that we had that was confirmed positive with the finger stick test we did last time, and then we swabbed her and she was also positive. So we have a certain coronavirus patient right here in this car. She's doing fine, she's doing well, just about 100% recovered really at this point. She's feeling fine. So we're going to do 2 tests with the new finger stick antibody kit that we got in, and we're going to question the validity of these tests. So it's been a month, so obviously she has antibodies. We know she has antibodies from the last antibody test, and so let's test these 2 kits and see what we get. So this is a test of the test. This is a big moment. What?
I want these 2 to be positive.
I want this kit to work, I know.
That's what I'm saying. My heart is pounding.
This is an informal scientific study.
This is ginormal. Is your heart pounding like mine? Because mine is just...
It's not pounding, I
Okay.
just
Let's check my heart rate.
That should be good.
I just hope that we've got something.
Looks about right.
What is it?
Look at this, let's get the tick-tock going here. Tick-tock, tick-tock. Positive? Both? No kidding.
Yeah, I can see it from here. I can see it from here.
You can see it from right here?
Look right, you can see the two green lines from here.
Oh, yeah.
And it started immediately. As soon as it crossed that
Oh my
threshold,
gosh,
it
that's so
started.
funny.
Wow.
Yeah, we're batting 1,000 so far.
Well,
Only
yeah,
2.
I feel a lot better knowing that now. That's a good sign. Okay, she's good to go. Oh, yeah.
When do you want her to come and re-swab?
We need to do a re-swab 2 weeks from symptom-free.
Okay.
Holy shucks.
So they're both clearly positive. Like instant, they said. It popped up instant.
Right.
Yes. Can
all
you
right.
see that, like, through the window?
So that,
Easy. You can see it from here.
okay, so that's encouraging then.
Yeah. Let's go.
Only 113.
It's fine. It's 115 now. See?
Only 150.
You're excited.
That's a healthy, normal heart rate.
Yeah, the IgM didn't read the first time. They're not reading here either for her. So, okay. So now, does that Improve. Well, it's a good sign.
It's a step in the right direction.
It's definitely, like if those were both duds, then I would have thrown that whole thing in the trash. So I'd like to do a few more positives. So hopefully Mark Lander, let me text him.
Yeah.
We just did a test of the test.
How did it come out?
They both came back positive on the China kit. So maybe the China kit, yeah, so maybe the China kits are okay. Like, boom, like lit up like,
Like as soon as you drop
it almost lit on fire.
COVID, I think it might be China.
Good point.
It's a good point.
Touche. I mean, it's not proof of anything, but at least, but it's a good sign. If we can do some more positives and they all come back like that, then I feel a lot better about that kit.
But just that, like the clarification that
Yeah, at least we know what a positive looks like.
exactly.
It's the first one we've seen with this kit,
And
so.
her like past is very prominent, and then the M is like
Is there a little M there even?
there is.
Oh, was there?
There is an M.
Oh, there wasn't even an M on the other one. What is it? Okay, so did you find us 10,000 antibody kits that are made in America?
No.
Did you find us
Shot it.
5,000?
No.
Minus 10.
Maybe. See, she's more realistic.
Oh.
Give me numbers, like take some zeros off of yours, please.
50.
A number without a comma in it.
Slow down.
27.
Let's start with 25, maybe.
Okay.
I did get in touch with the ChemBio diagnostic system, which is another one that's FDA
Yeah, EUA.
approved. So I spoke to him a little bit ago, and he put me in contact with Joseph Randolph, who is the sales rep. So I'm waiting for him to contact. So I did get information from him, and they are FDA
Wow.
EUA approved.
Okay.
So
Well, that would be the first. That'd be the first to have that.
So we'll see what
Here.
he says. That's why I said you can't get excited yet. But I've, spoken to somebody and I've got my foot in the door.
Hey, did you hear about that, Shirley?
That was a dancing move. You should have been there.
Yeah, you should have been dancing for that one. We did a test on the lady, our PUI 21, who was positive on the antibody, and then we swabbed her and she was positive. So we asked her to come back to test our new antibody kits that came in that are not made in America and wonder if they're working. And we tested her on 2 different kits, and they were both positive.
They were both girls bright. That's what I'm saying. Yes!
Okay, so
Can't move too much right now because I smashed myself.
so what's the prospect though? We're just waiting on calls really from everybody, and the worst that happens is we keep ordering those because there's no availability issue for that.
Not as of yet.
Not as much as we know. Antibody kits are in hot demand, and it's early. It's early. By mid-May,
I've gotten May 1st,
there's
May 15th.
going to be plenty. We keep working. We keep looking.
Break.
We're just going to close out this day with this. This guy right over here wants to close out the day today.
I'm gonna close out the day.
Our trusty cameraman. All right. Anything you're going to say to the public? Oh, it's not so easy now, right?
Put on the spot so you can prepare. You have time to prepare.
Nobody has time to prepare for anything. Like, comment, share. We love everybody. We're here to help. We're here to serve.
I love all of you.
He loves all of you. All right, enough fun and games. That's the cameraman. So we're going to close out for this Thursday. Still need to nail down our test site, and we still need to get great clarification on the utility of the fingerstick antibody test. Still question marks, but we're very happy that at least the test of the test kit we did today, both of them were confirmed, so those work. We're still looking for more confirmed positive cases in our county so we can continue to test our test kits, running an informal research study right here in real time. So we're going to show people that as we're doing it. That's it, everybody. Good Thursday. Enjoy this cool weather. It's going to be getting hot again soon. Back to work. Work, work, work.